Hello everyone, my name is Devyani and I'm one of the junior doctors at Lakeside Surgery. So for many people, the reasons behind delaying cervical screening can be a bit more complex. For example, if you're a survivor of sexual assault, it can be a frightening and potentially triggering experience to put yourself in. If you suffer from conditions like vaginismus, vulvodynia, or endometriosis, booking the appointment can bring up some extreme fear of potential pain. So here are some tips for having a smear test on your own terms, for staying in control, and to try and minimise any fear or discomfort. So first and foremost, during a smear test, you are in control. So if it hurts at any point, ask the doctor or nurse to stop. Secondly, let the practitioner know what your issues are beforehand, whether they are pain, trauma, or anxiety related. If they know, they can really suggest ways to try and lessen any pain. If you can, try and organise someone you trust to try and take you to your appointment and back home. And you can also take a mild painkiller like paracetamol or ibuprofen, which you can get over the counter 30 minutes before your appointment if you are worried about any pain. Another really good tip is before your appointment, you can ask for a spare speculum to take home and practice with. So a speculum looks something like this. You can ask your GP or whoever you are booking an appointment with, and this will really help you get used to the feeling of the speculum, if that's an issue for you, all in the comfort of your own space. If for any reason you can't get hold of one, that's absolutely fine. You can take some time to practice gentle penetration and stretching of the tissue with your own fingers as well at home. Another thing is, you can also ask to insert the speculum yourself. The practitioner will be more than happy to allow this, and they can guide you throughout that if you need it. And there are also many different sizes of the speculum, so you can ask your practitioner to use a smaller size. If you have vaginal dryness, you can ask the practitioner to give you some cream or more lube, which can make the process a bit easier for you. And another good thing to do would be to ask the practitioner to ask you before each and every step of the process if it's okay to continue, and also to describe what they're about to do before each and every stage. This could be potentially quite useful for someone who's had their consent violated in the past. Another tip I give is to practice breathing exercises beforehand, and there's plenty of this online or on YouTube. You can also take a podcast, music, or a meditation app to listen to even throughout the smear. And finally, you can organise a treat for yourself after the appointment, like a cake or a coffee, just to distract yourself and give you something to look forward to. I think the main thing to remember is that you can stop at absolutely any moment and rebook your appointment. Do not push yourself if you and your body isn't feeling it and you feel quite disturbed by the experience. It's absolutely fine to take a step back and to try again. To get some more further information on this, I've also created a guide to cervical screening document, which also gives access to more resources for people who may have anxiety or struggle with smears online. Thank you so much.